What makes flexion rehabilitation faster? Distraction or traction. Now, whenever you want to increase extension in those joints, you will move the joint into extension and you apply a little bit of overpressure. When you are applying that overpressure, what are you doing? You are narrowing the joint. You are doing compression. So generally in this part of the body and in the lower extremity, compression is used to promote extension. Traction or distraction is used to enhance flexion. But they are still form of arthrokinematics because they are taking place inside the joints in the body. So this further illustrating distraction. All right, so we're going to skip that and go to the next slide. Now, there's also another terms that manual therapists usually refer to. They say joint play. You know, I want to increase the joint play, or the joint play is this, is that. What is joint play? Joint play is just a phenomenon that allow movement in the joints due to laxity of the capsule. Do you understand? Look at the glomerular joint in this slide. If you look at the glomerular joints in this slide, you see that the capsule is very lax inferiorly, isn't it? If the capsule is very tight, nobody will be able to do any mobilization or manipulation now. But because the capsule can stretch and it's a little bit lax, it's able to allow some movement within the joints. And that phenomenon is what is called joint play. So joint play is the movement that occur in the joint as a result of laxity of the capsule. So all this gliding, we are going to do a lot of gliding in the spine. The gliding, the sliding, the rolling, the spinning, compression and distraction. Why is it possible to do them? It's because the joint capsule is lax. And it's because there's possibility of joint play. So we can even say that they are joint play. Rolling is a form of joint play. Gliding is a form of joint play. Spinning is a form of joint play. Same as compression and distraction. Okay? So we get that term very clear. Now we're going to joint shape. Another concept. Now, if you look at the diagram that you have above, you see different joints there. The A is typical of knee joint, isn't it? Where the distal end of humerus is convex and the upper end of tibia is concave. You can see that in A. So when the articulating surfaces are taking the opposite of another articulating surfaces, you will call that joint ovoid joint. So that explains knee joint. That also explains shoulder joint and hip joint. As hip joints you're seeing in that diagram, you see the head of femur is convex and the acetabulum is concave. So when the two articulating surfaces are shaped opposite, in opposite direction, that is an ovoid joint. But we have some complicated joints in the body. One of the articulating surfaces will be partly convex and the other part will be concave. Then the opposing articulating surface, where the upper one is convex, that one will be concave. Where the upper one is